Welcome, everybody, to the Arizona Commerce Authority Small Business Bootcamp and Resource Collective. My name is Andy Lombard, Executive Vice President of Innovation and Venture Development here at ACA. We wanted to, first of all, give a great shout out to all of our community partners for participating and lending their expertise to our Small Business Bootcamp. I want to really highlight as well the phenomenal work the National Safety Council Arizona chapter has done, who's presenting today. So thank you so much for all those safety pieces of expertise. This has just been a great series for us. The Small Business Bootcamp, as most of you know, is designed to help small businesses recover and return stronger. We've done that through a great outreach of community partners. We are going to extend this for the month of June. We're really working on topics, so one I'd like to ask today, if you could, is if everyone could please chat all the topics that you'd like to have us focus on for the next several weeks. This has been a great week. Our sessions have been managing your workforce during reopening, fantastic legal considerations for employers and employees. We've also did a great revamping of our business for post-COVID, presented by Traineal's Chris Ronzio. He did a fantastic job, so please do check that out. We'll post the site in which you can do that. And also, yesterday, Navigating Your New Workforce from Kaiser. They did a fantastic job in giving us just the kind of new things we must consider as we're starting to move into our return to work. And today we're going to continue our safety themes for Thursday with the Arizona chapter of the National Safety Council. And then tomorrow we have a really special guest from Global Marketing from Facebook. We're really excited to have her join our marketing panels and tell us how to really use Facebook for retail and small business and other activities. So please do plan on attending tomorrow at 9 a.m. So thank you. Without further ado, I'd like to give it to Robert Theobald, our Vice President of Small Business at the ACA, to give us an update on some of our activities. Thanks.
Hey, good morning, everybody. Continuing on, the main information we have still from the SBA is we're still looking at about $114 billion as of May 16th. Again, that's probably about $110 billion remaining for the PPP round 2 at this point. We do have some lenders that are processing these fairly quickly. If you're sitting with a lender and you haven't received very good communication over a period of time, be mindful that there are some lenders out there that can process these loans fairly quickly. Please let us know, and we'll can direct you to a handful of those that we're aware of that have communicated with us regarding that. Again, for PPP round 1 and 2, Arizona has seen about $8.5 billion of loans come into the state, and so that's a great number. Also some feedback we've been hearing is that the economic injury disaster loans are starting to flow to businesses in Arizona, and so that's great news as well. We don't have any numbers around those, but we are hearing from some businesses that they are starting to see those loans get processed as well. So thank you, Andy.
Thank you, Robert. Great update. Appreciate that. And just fantastic stuff on the small businesses on the PPP side. I think the effort's still going forward, but if you have not gotten your loans, please think about it. They're still available and they're still out there, and there's some great turnaround times. We're also leveraging all of our programming with our SBDC partners. Also, we're setting up a huge initiative with Arizona at Work, a lot of activities and focus around this. We have launched a new campaign, and we're going to try to get some of our representatives from Arizona at Work and our workforce team to come in and show us a little bit about what's happening there. So there's fantastic initiatives. Also, please keep in mind about our Arizona MEP manufacturing program. If you're a small manufacturer and need some assistance, please let us know. And then please do check out ArizonaTogether.org, a really important site for all of your resources and activities, as well as all the resources that we're going to be posting up on our resource collective. That should be available starting next week. We're working on the finalization of that. So please stay tuned for our resource collective portion, and stay informed at azcommerce.com/COVID-19 for all the information that you might need. So without further ado, we're going to continue on our Safety Thursday focus with the National Safety Council for Arizona chapter. Ed Tobey and Amber Pappas are presenting today, as they have in the last couple of weeks, and we really do appreciate all the important information that they're providing us to keep us safe at work and to have us return to work safely. So without further ado, I'll have Ed and Amber take it on. Thank you.
Very good. Good morning, everybody. Thank you for joining us. Hopefully you see my screen now. The COVID-19 Work 2.0. We're back. Now what do we do, right? For those of you that are new to this, we had a previous version that we presented last week that was kind of an introduction to the back to work scenarios and some basic things about the disease and how we've been impacted and some starting points. And so what we have done this week is we've kind of built upon that. So if you haven't had a chance to view the previous presentations, there is a link on the chat box for those. And for whatever reason you can't get that, I'll have my contact information at the end. If you want to shoot me an email, I can send you the link, or the people from the Commerce Authority might be able to do the same thing. But so if you want to listen to the previous presentations, those are available. So as he mentioned, there's myself and Amber. Amber's the good looking one. I'm a trainer for Arizona Chapter National Safety Council, do a variety of safety training topics. Our main ones are defensive driving and first aid CPR, but we also do construction zone flagger, lift truck, advanced safety certificate courses that have day-long presentations about incident investigation, ergonomics, and various safety topics. So we do those. And I'll also introduce Amber, my cohort today. She's actually the brains of the operation. So Amber, tell us a little about yourself.
Thank you, Ed. You're always too kind. My name is Amber Pappas. I am lucky to work at the Arizona Chapter National Safety Council. I work with Ed. We focus on more industrial hygiene, job safety analysis, investigations, stuff like that. I am also the president of Safety Help Today. We work with small businesses and large employers. We assist with OSHA compliance, safety and health training needs. So it's a pleasure to be here, and I'm looking forward to version 2.
Awesome. Thank you, Amber. So our goals today is to build upon what we did last week. We want to kind of go beyond that basic information and assist the business community and workplaces as you're reopening, returning to work. There's a lot of different things to think about. And so we'll kind of go through some of those today. Some of the effects in the workplaces, obviously, we can't do business the way we used to. There's going to be some changes. You have to be adaptable. There could be changes to how you do things, your operating hours, customer capacity is going to be reduced for a period of time. You might have to redesign some of those workspaces. You might have to put up some barriers and markings and signage and things like that. And because of this, anytime there's any sort of changes, especially something as serious as a pandemic, it can cause some stress and anxiety and uncertainty. So what we want to do is try to give you some information that's going to help reduce that stress, try to clear up some of the questions you may have, because it could be a bit overwhelming at this point as you get back. So we want to touch on, and we're not going to go into great detail about how it's spread, mainly through large respiratory droplets. Secondarily is prolonged contact with aerosols, which is really fine mist that's in the air. And then also from contaminated surfaces where we might touch those with our hands and then touch our face, touch our eyes, mouth, nose. Those mucous membranes is where it's introduced into the body. I have seen some reports as of yesterday, and I haven't seen anything official from CDC, but there's been a number of news reports that stated CDC is kind of downplaying the contaminated surface contamination risk compared to what they initially stated. But that's something to keep our eye on. Right now it's just news reports, and until we see an actual statement from CDC, we just want to keep doing what we've been doing. So the virus does remain active for periods of time, 2 to 3 days on plastic or stainless steel, 3 hours aerosol. So, we're going to have to design some of our controls over the virus activity and how to mitigate the length of time that it remains active. So one of the things we all have to be aware of is OSHA does not have a specific standard or criteria for COVID-19. They have published some advisories and various documents on how businesses can adapt. But as far as their actual enforcement, they haven't created specific enforcement actions for the COVID pandemic. But we all have to observe what's called the general duty clause, which means essentially as an employer, as a business owner, you have an obligation to have a workplace that's free from recognized hazards that are likely to cause death, serious physical harm, or disease transmission, right? Safety and health is how this is. So most people, when they think of OSHA, they're strictly focused on the safety side of things, but it is safety and health. And by the same token, the employees have obligations to follow the procedures and comply to the standards and to make sure that they're doing their best to remain safe. So a lot of what we're talking about today is going to fall under this umbrella of the general duty clause. So where do you start? I mean, you're back to work and you're opening up and you're starting to see some business activity that we previously didn't have. I'd suggest start with a clean facility. That's kind of a basic thing. The level of depth of cleaning and sanitizing is going to be dependent on the type of business that you have. But if you start with a clean facility from the get-go, that's really important. You want to have somebody in charge as kind of a leader, but also get input from others. So form a task force or committee or group of people so you're getting a wide range of input on your safety planning and your controls. Some businesses are really small. Maybe there's only 1 or 2 people in the entire business. And I understand that, but when you have a little bit larger group of people, solicit that input and variety of opinions and knowledge bases that you can use. You want to determine what your potential for exposure is, identify any gaps that you might have. We're going to talk significantly about disease prevention plan, and we're also going to talk a little bit about emergency preparedness, and it is a slightly different topic, but since we're planning, we need to plan, right? And so emergency preparedness and disease prevention are a little bit different criteria, but they're both really, really, really important. And we also suggest you have some sort of orientation when people come back to work right from the get-go, have an orientation, almost like a new hire orientation, where you're going to give them some information. Here's where we are today. Here's what we're doing to try to mitigate the exposures and ensure everybody is safe. And we need your input. We need good communication. We need to really talk about those changes and encourage. This is not a one-way street. It's not a dictatorship. This is a conversation we all need to have. If you have concerns, bring them forward and we can address those. But we really need to focus on the positive aspects of, okay, we're reopening. What can we do on a positive way to recover our business and build it back to a point where we were before? And so if we can focus on the things that we can control, focus on the positive aspects and not dwell on the negative things that you're hearing out there, then I think we're going to be a lot more successful. And then the other thing we have to think about is when your employees are coming back, we don't know what sort of situations they have been exposed to at home. Maybe they've had a family member that has been tested positive, or maybe they've had to care for somebody. Maybe they've struggled with daycare. Maybe they've struggled with unemployment. So there could be some other issues that come into play. So just kind of be cognizant of potential changes in mental health. There may be some additional uptick in substance abuse that we may have to make accommodations for. But what we want to do is try to do the best we can to make sure that we're bringing the people back safely and healthy in all ways, not just physical health, but mental health, right? So I put this link really, really, really big, and I'm going to leave it there for a minute and give you a chance to write that one down. I didn't put it at the end. It's right here, because if you don't know where to start, this page is gold. It has a lot of information. It's going to get you a long way into helping you create your plans. It's got information on the latest standards, updates, changes, how to do hazard recognition studies, what kind of medical information is surrounding this virus. And it also has some really cool general industry guidelines that are specific to different types of industries. And so this is kind of a screenshot of what that page looks like. And under the highlights tab, where you see all those different alerts and guidance for various industries, you'll also see that under control and prevention. It has healthcare, dentistry, emergency response, post-mortem laboratories, all these different business categories that are really, really helpful. Now, yours may or may not be listed there, but find something that's similar to yours and kind of use those guidelines to help you in your planning process. So I can't emphasize enough that this particular OSHA page is a huge, huge resource for you. And I would, if you don't know where to start, I'd say start here, right? This will get you about 75% of where you need to be. So let's talk a little bit about how do you analyze risks and exposures. And there is a process called job hazard or job safety analysis. It's same terms used for the same type of process. And what it involves, and I want to emphasize right from the beginning, this does not have to be a really complicated, overwhelming process. The point here is to keep it simple. We want to look at our jobs. For example, a job is an electrician, but a task is changing an electrical outlet. So you want to focus on the task. What do I need to do to change that electrical outlet safely? And you go through the steps, and then what kind of precautions and controls do you have to take in order to accomplish that task safely? So that's what we're going to ask you to start thinking about, is take the bigger picture, break it down into specific tasks and steps, and then analyze those tasks and come up with identifying what the potential hazards are and then what controls you can put into place. And if you do that very systematically and keep repeating that, it's actually a pretty simple process, right? And so there is a form that the National Safety Council uses. By the way, we have a one-day class of job safety analysis. So we could easily talk about this subject all day long. We can go into depth. So that sort of training is available. So if you want training specifically on how to identify hazards and how to implement some controls, this form is a really basic sequence of steps: identify hazards, recommended action or procedure. And you just log each of those, keep a file of them. By the way, if you ever have an OSHA compliance officer show up, these types of documents are going to be really valuable for you because it shows good faith and shows you're trying to mitigate hazards and you're trying to do the right thing. So when you do these sorts of analysis, don't just crumble it up and throw it away. Keep a file, and that can help you certainly down the road. And it also gives you a reference to go back, a month from now, 6 months from now, and just re-review those tasks. Has anything changed? Do we need to update this form and the processes? So my point here: identify your hazards, but keep it simple. It doesn't have to be this highly technical thing. Now, obviously, if you have a manufacturing facility that's 100,000 square feet with 500 people, yeah, now you might need a consultant to help you with that. But for most smaller businesses, this is a thing you can do on your own, and you can easily accomplish it. And it's going to create a focus. Once you even just start looking at these things, you're going to be surprised on some of the hazards that maybe you've been not aware of in the past and kind of breezing past, right? So I will touch briefly on emergency preparedness. Now, I will acknowledge that emergency preparedness doesn't necessarily apply to a pandemic directly. But we're talking about planning, we're talking about implementing controls, and we're talking about how to handle unexpected issues. Most businesses are required by OSHA to have an emergency action plan. And so if you don't have one in place, and we did a poll on the previous presentations, and about half the people acknowledged they didn't have any sort of emergency preparedness plan for their business. And so I'm going to encourage you, as part of the planning process, not only for the pandemic, but bigger picture, what do you do in case of a fire, weather-related, power outage, terrorist attack, any sort of things that might involve your business. You need to kind of have a plan in place on who to call and who acts and those kind of things. So OSHA does have a evacuation plan and procedures e-tool. The link is on our resources page at the end. Because it's a long link, I didn't want to put it on this page. You wouldn't be able to copy it anyway. But OSHA has an e-tool that you just fill in the blanks, and in about 15 minutes, you have a plan ready. So once again, this is not an overly complicated thing, but it's a basic thing that every business should take care of. So I'm going to turn it over to my friend Amber here. She's going to go through some of the disease prevention, industrial hygiene, and some OSHA specific topics, and I'll be back a little later on. Amber, take it away.
Thank you, Ed. So to kind of tie in with what Ed's been discussing this entire time. So again, from an OSHA perspective, going back to obligation and duty as the employer. Simply put, we go back to that general duty clause. We have to have plans and systems and procedures in place indicating that we've done our due diligence. We can demonstrate good faith effort, that as an employer, we are assessing the workplaces for potential exposures. And again, as Ed pointed out, that includes safety and health. I love that he included the job hazard analysis tool. Like he said, if you're starting from scratch, not sure where to start, that OSHA website is great. But you also have to do that assessment. Ed is absolutely right. I was actually on an OSHA walk last week. They want to see those things. They want to see, are you doing assessments? Are you doing those hazard analysis in your work sites to find what are the exposures, safety, and health? Going back to, again, referencing Ed's example with the electrician, I think that's great. Combine it. We don't necessarily need to do 2 safety assessments, right? So we can combine it. If you've got, somebody working at the front desk, we're going to use that hazard analysis to look at the safety sides, the slips, the trips, the falls, but then also the health side of it. What are those exposures? And so to tie into that, when you're putting this together, you're looking at the potential risk and analyzing your exposures. We use the term industrial hygiene processes. So this is the health side of things. Industrial hygiene hazards includes things like physical hazards. You've got noise, vibration, temperature extremes. Arizona, let's talk a little bit about heat, right? So that might be factored in there. Biological, I'll touch on in a second, but ergonomical, that's basically the way that we do our jobs, whether it's office, whether it's standing, and how the biomechanics of our body and the physical effects to that. And then chemical, we have to take a look at hazards introduced in the workforce. Even with this COVID prevention, we've seen a lot of control measures with disinfecting, and we're bringing in certain chemicals. So we have to take a look at that. Why they're a great control, what are these new chemicals that we're introducing into the facilities? So the process of industrial hygiene includes anticipating hazards, recognizing hazards, then evaluating, choosing controls, and confirming. And what confirming is, it's that reevaluating, going back and looking at the procedures that we've put into place, and is it working? Oftentimes I tell employers, don't get overwhelmed by that. Start where you need to start, and we'll give you some examples, and then go back. That's where you do the assessments, you do the inspections, and you find out, okay, we decided to use this type of glove, and we found out that it wasn't necessarily working, or, maybe some workers had problems with it, so we're going to go back and reassess it. But I wanted to point out with the disease prevention preparedness plans, again, think beyond COVID. We talked about that in session 1. This isn't going to be the only biological hazard that your workplaces might see. When it comes to biological hazards, occupational exposures can include things like bacteria, viruses, fungus, or any other living organism that can cause acute and chronic infections or diseases. I worked with a facility that at one point called me in a panic, going back to that emergency thing. They had an outbreak of a parasite and again, hadn't really analyzed for it, weren't aware, didn't know what to do, and so it became almost, again, an emergency situation. So tying back into Ed's point on we have to have plans with emergencies, but occupations that deal with plants, animals, food processing, laboratories, and then for the most of us, any occupations that have the potential to come in contact or exposure to bodily fluids, we have the potential to deal with bloodborne pathogens, right? And so it's important that we, when evaluating, we take a look at all of the industrial hygiene hazards and put those plans in place. Again, if you're not sure where to start, I appreciate that Ed put up 1910, 1030, the bloodborne pathogen standards. Great resources. Again, if you go to the OSHA.gov website, they've got some templates out there. So don't reinvent the wheel. Don't start from scratch, right? PPE, there's some stuff in there as well. Respiratory protection standard. If you're dealing with, again, chemical hazards that might affect, when you're dealing with chemicals, I want to point out harmful chemicals, they come in all different forms. It's not just liquid. So when you're doing those assessments, you want to look for solids, gases, mists, dust, fumes, vapors, like Ed showed earlier. You know, it depends on the type of chemical and the airborne contaminants, but also factor how it affects our body, right? We see that chemicals, we can inhale chemicals through breathing. We have absorption through contact with the skin, maybe the eyes, ingestion, right? Eating and drinking. Oftentimes we'll see that. We'll see workers who will, you know, maybe use a certain disinfectant and they're not wearing gloves, or maybe they are, and then they go and eat. So what are the processes and controls that we're going to put in place to prevent that? And then this one sounds odd every time I bring it up, but it does happen. Injection, right? How do workers inject some of these chemicals? Maybe it's lack of training and education on how to use the tools and equipment that have that. So you want to refer to safety data sheets. Great information. I know I consider myself a safety nerd. I love reading safety data sheets. There is some phenomenal information in there. So if you're not sure where to start with your disease prevention preparedness plan, take a look at all the different hazard types, the processes, and Google is your friend, and so is OSHA. There's some really good templates out there with that. So when thinking about whether it's your emergency preparedness plan, your disease prevention plan, there's some general things that and precautions that you can put into play into effect now without having to have this all, we got a question, Amber, do I have to have it written down? Having all of this stuff having it written, yes, I'm going to recommend that because, and we'll talk about it a little bit later and why that's important, but before you get there, you can start here, right? So we've talked a little bit about respiratory etiquette. What does that look like? You know, encouraging workers to use tissue to sneeze in their hand, hygiene and sanitizing. Ed's talked about that. Start with a clean facility, and then let's implement some procedures and training to continue to reinforce what it looks like to sanitize. Hygiene. You know, I mentioned a facility that had a parasite outbreak. That all arose from hygiene. It arose from a worker coming from home and then using similar PPE. There was a shared PPE process, and they also didn't look into their laundering processes. So there were some gaps and some holes in there, which created the potential for the entire facility to be exposed. So take a look at that stuff. Also the PPE, which I'll talk about in a little bit, what it is that we're going to implement right away. Before we get anything written on paper, you can absolutely start here. So we talked about this in version 1, but I gotta throw it in again too. When you're putting your disease preparedness plans together, your emergency action plans, again, there's a lot more in place. Start here. This is your foundations. This is the basics. OSHA refers to this as the framework of the hierarchy of controls. And again, the best way to control a hazard is to have a systematic approach rather than relying on human behavior. So if you've never seen this before, we've got an upside down triangle or a pyramid. And if you look at the left of it, at the left side, you'll see as you travel up, we see more effective controls like elimination. If we can eliminate the hazard, that's the best thing that we can do. Substitution, an example of substitution, more so maybe with chemicals. So if we're using a toxic chemical, maybe we substitute it with a less toxic or a water, a water-based product. But what we're going to focus a little bit on today, again, is engineering controls, administrative controls, and PPE. And I want to point it out because I am still today, when I'm doing my audits and my workplace inspections, I'm still seeing a lot of employers, while they have plans together, whether it's a COVID prevention plan or diseases prevention and preparedness plan, they've got it down and in writing, but I'm still seeing we've skipped the entire process of engineering and administrative, and they're going right to PPE. And word of caution, when PPE is your only control, there's a lot of room for failure in there. And if you've noticed, when PPE fails, there's a direct result in a hazard, or an injury or an illness. So don't rely so much on PPE. If you go to the OSHA website that Ed put up there, you'll see OSHA's actually put out some memorandums encouraging employers, because we have a lack of PPE and during this pandemic, they're encouraging employers, go back, look at your engineering and administrative controls, try to implement them, go back and refresh before going right to PPE. So I mentioned this a lot, but Ed pointed out it'd be good to have an illustration of this. So as safety professionals, we talk a lot about the Swiss cheese model. When you're doing your assessments, whether you're using the JHA form or something, anything else, you're trying to identify what's the exposure, what's the risk. Oftentimes, you're going to implement more than one control. It's not going to be just engineering or an administrative procedure. Maybe you're going to include, 3 or 4. And so, not going to spend a lot of time breaking this down, but just for illustrative purposes, I wanted you to see, if you look at the left of that first Swiss cheese graphic, you're going to see there's an event, there's a hazard. So maybe it's an exposure, right? And so you'll notice engineering controls might be that first slice of cheese, but maybe there's some holes in it. Maybe it's a physical barrier or ventilation, and the hazards passed right through that hole and it works its way all the way down. So that's where you're going to use multiple controls, engineering, administrative, maybe PPE, training, with the goal being to try to stop as many of these gaps as possible. So that's what we refer to Swiss cheese model. But again, keep it simple. When you're putting your plans together, look at all the possible options and implement controls that are going to be effective, right? So again, on that hierarchy of controls, that upside triangle, we want to obviously eliminate. We want to try to substitute if possible. But when dealing with, disease prevention plans, engineering controls is going to be a good place to start. And so you see things like increased ventilation, physical barriers, as you have in this picture, reconfiguring your workspaces. If we've got an entryway where maybe employees or public come in, are we going to reconfigure where they can be? Again, that social distancing. Are we going to remove steps, cubicles, offices, those types of things? Maybe we're going to install things like touch-free faucets, trash cans, towel dispensers. A simple thing that I've seen a lot of workplaces do, they're opening doors. We've got a lot of doors in our workplaces, and that's a lot of places where people can touch. So maybe we keep them open, right? And so these are things like engineering controls. The one thing that I want to point out with engineering controls and why they tend to be more effective is engineering controls isolate the worker from the hazard. They don't rely on the worker. So that you see in this example, you've got a physical barrier that's installed that doesn't require any interaction with the employees, that doesn't require them to do anything. It's isolating the hazard. And so again, that's why this tends to be more effective than PPE. So when you're doing your assessments and you've noticed, okay, here's a potential hazard, this is the exposure, what controls are we going to implement? Let's let's look here first. Can we introduce something like this? Next, when we can't implement an engineering control, or maybe we want to do more on top of that engineering control, we're going to go to administrative controls. Tons of examples with administrative, but what I want to point out, while engineering tends to be more effective, these controls require action by someone, whether it's you, the employer, whether it's the employee, and they often include changes in the work procedures or policies. So we've seen some workforces do staggered work hours, right? Or we have what we call our safe work practices. Maybe that's break time. Not everybody takes break at once. Maybe it's, continuing to remind our staff and our workers that, hey, while I appreciate that we're wearing gloves, we don't want to touch our workstation and then go and touch somebody else's workstation, or maybe use their phone or, their reference guide. So these are certain procedures and practices that you want to take a look at and implement. Obviously, I threw in there, take a look at your travel policies, consider what's essential versus non. Here in administrative controls is where we see the disinfecting and hygiene. Take a look at your procedures for this. Again, I'll just use that example of that one laboratory that had to shut down. They had a gap when it came to laundering. They had workers who were using PPE. They were using gowns that were often shared and had to get laundered, and they didn't necessarily have a way to isolate those gowns. They were all on hooks that touched each other. And so the one individual who came to work with this particular parasite took the cloak off and put it on the hook, which then touched others. And so you need to take a look at all of your procedures, what the potential hazards are, and implement effective. And I use the word effective, meaning can you logistically do it? And is it going to effectively reduce or eliminate the potential for that hazard? Signage is good. Signage is another way to just remind your workers throughout the facility of, hey, we've got these procedures in place. We're asking that you wash your hands after certain things. But education and training is a good one. I, again, obviously as a safety and health trainer, I love it. Ed does as well. But this is your opportunity. Rather than, again, just jumping to PPE, let's train. Why are we implementing engineering controls? Why is that physical barrier there? Why is it important that we have touch-free faucets? Well, again, it's to prevent contamination. It's to disinfect. Why are we labeling our disinfectant bottles? Well, it's important. Your workers need to be trained on these controls so that they too can effectively implement them. Oftentimes, I've seen some gaps where we put these elaborate plans together and then we kill it by not training our workforce on what we're doing and how to properly implement them. So lastly, with PPE, while PPE is good, again, as a safety and health professional, I just have to implore you, make sure you've done your research. Make sure you've done your assessments. Make sure you've tried to implement those controls that are higher up on that hierarchy, that upside down triangle first. You can absolutely include this in there as another way, again, that Swiss cheese model. But you really want to take a look at what's available. Right now, I know that we're still having a challenge. I've had quite a few questions on, hey, Amber, what about masks from China that, NIOSH hasn't stamped? And what about this? And as an employer, OSHA has recommendations, NIOSH has recommendations, but it falls on you as the employer. You need to make sure that you're doing your research when selecting. If you're going to mandate that your workforce wear PPE, you need to make sure that you logistically can handle it, that you can provide it, but then also that you need to train your workforce on how to properly, we use the word don in safety professionals, meaning you need to teach them how to properly use it, maintain it, fit it, right? Does it fit? Is it going to work well? And then dispose of it. Really quick, I want to talk about also, there could be some regulatory implications. Let's talk about that N95 that's on that picture versus a homemade mask. So we call those face coverings. That is not a form of PPE. It's something that employers can allow employees. If employees want to voluntarily wear something like that, that's fine. But if you're going to implement mandatory work procedures for staff to wear the N95s, OSHA, there's another memo out there, you still have to make sure that you're conforming with the respiratory protection regulations. And in there, you have to have a written respiratory protection program. You have to have procedures in place that you have selected a respirator that meets the hazard. Oftentimes, these have different protection factors. So the N95, for example, is not oil proof and it's 95% effective. I see people that are wearing the N95s with the excess flow filter. When you sneeze or cough, that excess flow filter allows those aerosols to go out. And so OSHA talks about it. You need to be educated on what is it going to protect from. You need to train your workers, but then also they have to have a fit test and a medical evaluation. And right now that's kind of challenging. So before you jump right to certain PPE, do your research, please. Make sure that you can effectively and logistically handle it, you can train, and that you're following all the OSHA regulations that come attached with that. So we wanted to throw in some information on record keeping and reporting. We've got a lot of questions on this, so I don't have time to really dig into this, but I will tell you that website that Ed put in the very beginning, there is some phenomenal links on this. OSHA's actually done a really good job. They've got a good database, Q&A. I guarantee you, if you've thought it in the question, it's on the OSHA website. So take a look at that. But what I wanted to point out, we've gotten some questions. Hey, Amber, you know, is COVID-19 a recordable illness? Yes and no. I can't straight answer that. It depends. And so OSHA's put out some guidelines, but I just want to highlight a few things. It is a recordable illness, and employers are responsible for recording cases if you look at the determinations under 1904.5, if the case is a confirmed case of COVID-19 as defined by the CDC, right? So we need to take a look at that. Also, if the case is work-related, according to 1904.5. So again, it happened at work. It's an injury or illness that sometimes it might involve signs and symptoms that surface at work, but it was solely due to non-work related activity. That wouldn't be recordable. So that's going to be a little hard to determine. But other things that you have to factor too is maybe eating and drinking personal consumption. That wouldn't be a recordable as well. So OSHA's got some guidelines on that. But again, if it's a confirmed case, if it's work-related, and then lastly, the case involves one or more of the general recording criteria, which may be death, injury, illness, loss of consciousness, days away from work, restricted or light duty, basically non-first aid, then it would meet the recordable requirements. But I want to point out there, OSHA actually on there, they put a memo out, I believe on April 10th, giving some more information on this because it's hard to determine. So they've got some information. I'm going to read it really quick and then I'll move on this one. But in areas where there's ongoing community transmission, employers other than those in healthcare, emergency response, and correctional institutes may have difficulty making these determinations, and OSHA recognizes that. And so they've actually, in light of those difficulties, OSHA is going to exercise discretion. So they're going to take a look at a few things. They're going to look at, is there evidence that COVID-19 is work-related? An example might be maybe you have multiple numbers of cases developing in a certain work area. Also, they're going to look at, is there evidence that that you were given information specifically due to workplace? So they get it. OSHA understands this is still going to be a little challenging for certain workforces, but take a look at that information on the website. And then lastly, reporting. I want to throw out there's some good information under the 1904-39. There's some requirements for employers if there's fatalities or hospitalizations. There's some time requirements, 24 hours in which you have to report things to OSHA. So again, just go to the website. You can reach Ed or I afterwards if you've got more specific questions to this, or maybe in the Q&A we'll hit that. So I want to finish up with infection protocol. So when you're looking at your plan, When you're putting your plans together, have a good protocol based on exposures and incidents, not just a one size affects all, because you're going to have different levels of exposures. You can see in here you've got primary, which is an individual that's actually been confirmed diagnosed with COVID-19. Then maybe you have primary symptoms or direct exposure, secondary, and this one's a tough one for me. Tertiary, thank you, Ed. But have protocol in place right now that your staff is educated on, so it's not a, oh my gosh, so-and-so's sister's cousin was exposed to, what do we do? When it comes to primary, you might take a look at having quarantine policies. So if somebody's tested positive, maybe we have a policy in place that they stay home for 14 days and until they have been retested and are now negative. Or who are we going to notify, right? Are we going to have a team? Are we going to identify other workers who may have come in close contact and then maybe they jump to the next secondary category? And then are we going to clean and infect those work areas? For those who might have primary symptoms or they've had direct exposure, we're going to take a look at maybe, again, having a quarantine policy, or they just go and get a test and find out if they've been negative. Who are we going to notify? Are we going to look at their work areas and then take all the way down? So, we've got some good documentation. There's some awesome information online about developing procedures based on these different levels of exposure. Because oftentimes, going back to that, again, secondary, maybe they don't need to quarantine. Maybe we have them go through they do some self-monitoring because they weren't necessarily in direct contact. Maybe they were in an area. So it's going to be different for different workplaces, but it's important to have these already in place. Again, not just COVID, but your entire disease prevention preparedness plans and who's going to handle it and where we're going to go from there. So I am going to hand this back over to Ed, who's going to talk about, again, some more recommendations on what to do before your workforce returns.
Thank you, Amber. Awesome job there. So when you do return to work, or as you're returning to work, some companies are implementing additional screening measures. And this could be interviews, it could be questionnaires they have you fill out, sign an official affidavit that you've agreed to these specific things, or you've not traveled to these places, or there's a lot of different information that they're going to ask of you. They may ask about some of your medical history with good intent, because there's people that are higher risk. It has to do with age, underlying health conditions, things like that. And as an employer, just out of caring for your employees, you might ask some of these questions with great intentions, but actually start to cause some issues from privacy standpoints and ADA specifically. So, and there's also a question I have on the chat about temperature checks, that their company is beginning to take temperature checks and doing mandatory masks. So this will cover some of that answer as well. So what you need to think about as you implement these new procedures is, are you going to be in compliance with the various agencies that regulate this type of process and information? And everybody thinks, well, it's privacy, medical privacy, oh, that's HIPAA. Well, in fact, HIPAA only regulates medical providers and insurances and people that process those types of claims. So HIPAA doesn't apply to you and me at the regular workforce, but everybody just assumes that any violation of medical information automatically falls under HIPAA. It does not. OSHA has a lot of policies that are integrated into HR policies. For example, if your company requires everybody to wear a face covering, that's enforcement is going to fall under your HR policies and procedures. So a lot of the reason we put OSHA in here, because it is directly related to your human resources policies. Often in smaller companies, the human resource person is also the OSHA compliance person, because you don't have enough people to have specialists. So these subjects do overlap into human resources, but we really want to focus more specifically on ADA and EEOC. Now, ADA laws are all about addressing people with disabilities and making reasonable accommodations for those disabilities in the workplace. But part of those laws also provide protections of information. And when you're looking at the EEOC, it's more geared toward anti-discrimination laws, but these also include age and disability. So there is some overlap between ADA and EEOC back and forth. And a lot of their standards are very closely related to each other. So we want to make sure that when we're asking questions, for example, if we have an employee come back and you say, hey, just out of, for your own protection, for our protection, does anybody in your family have COVID? Well, you can't ask that question legally, because now you're asking direct questions about the employee's family's health. However, you can ask a general question: have you been exposed to anybody that has a confirmed case of COVID or has COVID symptoms? So you can ask about your exposure to some, and you can do that legally, but you can't ask specific questions. Hey, do you have any compromising health conditions that would put you at a higher risk? Because if you ask questions like that, you might also be potentially exposing a disability, and you're not allowed to do that. So the types of questions you ask and how you ask them and the wording you use is going to be really, really important. And I did see at the beginning during the introduction, you had another seminar earlier in the week that dealt with a lot of these issues. And it's not our intent to go super deep into these. In our presentation, this is just to create an awareness that you have to be really, really careful. And so along those lines, what we have to try to address, because the question came about temperature checks, and a temperature check is considered under ADA as a medical examination. And medical examinations for regular employees is not allowed under most circumstances. However, if it's determined that the employee's ability to perform essential job function may be impaired by a medical condition, or an employee will pose a direct threat due to a medical condition, that's when the rules start to change. And this term direct threat is under ADA is a really significant term because the direct threat is also tied to the declaration of COVID-19 as a pandemic. That triggered some different set of standards that can be used to allow employers to take temperatures legally, because the employee could be considered a direct threat if they have symptoms of COVID-19. So I say it's a little bit more complicated when you get into these issues, but we have to make sure that, and once again, we're trying to do the right thing. We're trying to protect people with great intentions, but sometimes those intentions can be misapplied and get yourself into some issues. So hopefully that kind of gives you some awareness. Like I say, the intent here wasn't to dive super deep into these issues, but just create an awareness. And what we're just kind of talking about, the pandemic was declared. COVID-19 is classified as a direct threat, but you cannot make disability-related inquiries. And the medical examination, which is the temperature checks, are now allowed where they previously wouldn't be. And at some point, once this pandemic is considered to have passed, those medical examination temperature checks are not going to be allowed again. The other factor under ADA is employers are required to make reasonable accommodations for people with disabilities, but there also are standards that talk about undue hardships to try to create those accommodations. So if you're into these situations where you're making accommodations and your employer doesn't feel that that's sufficient, you may have to dive a little bit deeper into these laws and regulations just to make sure that you're doing the right things here. So contingency plans, this isn't the first outbreak of a disease is not the last. We don't know, as restrictions are lifted, there's some people predicting a second spike. I don't know, we don't know. This is all new. So, but the important thing is let's have a plan, because we didn't have a very good plan going into this overall, because nobody really anticipated this. So let's create some plans in case you need to shut down again, in case another pandemic comes through. Just like I say, this situation has created an awareness that we all need to do a much better job of planning, because failure to plan is planning to fail. So lastly, I can't say this enough, proper planning and being adaptable, being flexible. Entrepreneurs by nature are, always constantly trying to make things better and improve their businesses, workflows, and things like that, policies, procedures. And if you can do that, adapt to the new normal, whatever that normal is, if you properly plan and adapt successfully, then you will succeed as a business. So I can't emphasize that enough. The point here is for you to try to make sure that whatever you do moving forward creates a healthy, safe workplace, but you're also successful in business, because that's your ultimate goal, is to have that success. With that, we're going to take some questions.
Thank you, Ed. Thank you, Amber. We do have one question over in the chat from Michael. He's saying, we're doing mandatory face masks. We've started doing temperature checks, and we're distancing as much as possible. Are there any other safety precautions we should be taking?
So I want to add to that. I know that Ed, thank you, addressed some of the, not necessarily, but just some factors to consider when it comes to the temperature scans. But I want to just, again, I want to go back to with this question, take a look again at those engineering administrative controls first. While the mandatory face masks might be logistically, okay at your facility, take a look at some of the implications with that, again, with the masks. And when you say masks, I'm not sure if you're referring to what we call face coverings or the the white ones that we see that are stamped respirators. You really need to be careful if you're going into mandatory respiratory protection, because now you have to make sure that you are in complete compliance. And that, I can tell you, I've worked with a lot of facilities, that is challenging. You have to, simply put, with those, you have to make sure that your employees are medically capable to do that. We have a lot of heat issues. We have people that have difficulty breathing already, maybe asthma and other health effects. Then you get into some of the stuff that Ed was saying. So if we're implementing a policy, just a blanket policy, just because that's what everybody's doing, I want to recommend you go back in that triangle, go back and look at some of those engineering controls. So safety, the distancing is great, but maybe look at isolations, right? Maybe look at where physical barriers, some of those other things, administrative controls, changing, break areas, who's there at certain times, disinfecting procedures, right? So I want to encourage you, while what you're doing might be okay, it seems like we're kind of on that lower end of the triangle. So take a look at some of the stuff higher up with administrative and engineering, and make sure that you're implementing those, because again, some of this stuff, the temperature screening, it's reactive, right? So if somebody's got a temperature, they may have already been exposed, and we're starting to see issues with the accuracy of the temperature screenings. And then again, the face masks, ask yourself, are you introducing new possible hazards? So again, best recommendation, take a look at some of those other controls that you can implement. But I know Ed wants to note on this as well.
One other aspect of the temperature checks is it is a requirement under ADA to maintain privacy. This is a medical test, and you're making a medical determination, so that falls under the ADA privacy. So if you have a line of people coming into the business and you're scanning one at a time, and the person scanning says, oh, you're 98.2, you're good to go. You're 99.9, and oh no, you have a fever, go home. If you're doing this in front of other people, now you are essentially exposing medical information. So you have to be really careful, not only doing the screening, your process, but maintaining that confidentiality that's really, really, really important under these regulations. All right, do we have any other questions?
I'm not seeing any others, and we're just at the hour. So I guess I just wanted to say thank you to our panelists, Ed and Amber. They'll be back this afternoon to do this session again for 3 p.m. if you know people that couldn't make this 9 a.m. session. And additionally, I'll send over the link one more time for our bootcamp website where you can register for next week's sessions or watch past sessions. Ed and Amber did a great webinar last week on some of these safety practices. And so I'll link to that as well. But Amber, Ed, thank you so much. If you have any final comments, love to hear them. Otherwise, can let you go.
Well, thank you very much. I did put up a resources page, and if you wouldn't mind leaving that up even after the sharing has stopped, that way people can have a chance to review some of those. But we will make this presentation available to everybody, both the link to the recording and copies of our presentation slides. So if anybody wants to review those later on, you can. But thank you very much for allowing us to join you today. And Amber, great job as usual.
Thank you.
Great, thanks everyone, and we'll see you back this afternoon.